Hello and welcome to Dr. Carri's Clinical Corner. Today we're going to talk about prolapse and what is a prolapse. So a prolapse means your organs in the pelvis are lower in the pelvis than they should be. So let me show you. So this is your uterus and the bladder and the rectum. So they kind of sit in the pelvis like this. And then if any of them, let me start to show you. If any of them start to like poke on through out here, it's hard to see, but like that starts poking through, that's the bladder. It could be, it's hard to do this. It could be this starts poking through, this is your uterus, starts coming out, or it can be the rectum starts coming out of the vagina. So if you see the rectum, this is just like the last piece of it, it's curved. So for some people, like this is the rectal hole, the anus. But for some people, it can sort of start to like, instead of connecting there, a little pocket of it sort of comes forward. So imagine, oops, I have it upside down. Imagine this pocket starts to like dip into there. There can be a rectal prolapse through the rectum, but that's pretty rare. So if the bladder is the one coming out, it's called a cystocele. So you might see that with a CY. I'll put it on the screen. If the uterus is coming out, I don't think this has a name. And if the rectum is coming out of the vagina, it's called a rectocele. But if the rectum is coming out of the rectum, out of the anus, it's called a rectal prolapse. So anything with a cele at the end, cystocele, rectocele, means that organ is protruding out of the vagina. So that's the different types of prolapse. And what causes it? Pressure, so chronic constipation, childbirth, pregnancy, some sort of abnormal pressure.